My name is David Deboer. I'm an orthopedic surgeon here in Nashville, Tennessee. Along with Dr. Michael Christie, I was one of the founding members of Southern Joint Replacement Institute. When I was in medical school, I really got to see all the different specialties, but the thing that drew my attention was orthopedics, and probably because of the engineering aspect of that, I found it to be pretty easy for me, and I loved it. And so when I applied for a residency, I applied in orthopedics and did my 5 years there at Vanderbilt. And during that time, I specifically became very interested in joint replacement surgery because of the kind of the mechanical nature of the implants, the way the joints move, the kinematics of the hip and knee were very interesting to me, and I just fell in love with it. Southern Joint Replacement Institute is a practice where we specialize only in joint replacement, where we take care of patients that have shoulder, hip, and knee arthritis. We're a practice that we do primary joint replacement, so if you have arthritis and you come in to our practice and you need a joint replacement, we're a one-stop shop for that. If you've had a joint replacement and it's failed for any reason, whether it's 30 years old and you need a revision surgery or you're having some mechanical issue with your joint replacement, we're subspecialized in that in doing revision surgery. So Southern Joint Replacement Institute is the only orthopedic practice in Middle Tennessee that just specializes in joint replacement surgery. For me, joint replacement was an operation that you could truly impact someone's life and you could consistently do it. As long as you were able to perfect your surgical techniques and consistently perform an operation that gave excellent results, the majority of your patients were very, very happy. They returned to a near normal lifestyle. From day one, I wanted to track all of the aspects of surgery, all the aspects of patient care, and then all of the outcomes related to that. And so I started a little database back when I was at Vanderbilt, and we've kept that database going all the way through today, which is 35 years later. Fortunate to have joined in with HCA, because one thing HCA does really well is they track their data. And so over the last 35 years, we've been able to perfect our surgical technique and look at different ways of doing joint replacement so that we maximize our outcomes with the most efficient care possible. Our philosophy from day one and at Southern Joint Replacement Institute has been to take excellent care of our patients, take care of them just like you would your own family member, to consistently have the bar set high so we take the best care of each and every patient. We like to also we like education. We like teaching nurses, teaching physical therapists. We like to give back to our community. We work through a foundation called Walk Strong, and we have the philosophy that instead of going to these remote areas or third world countries and doing the joint replacement for them, we like to go in and train them to do their surgery, maybe even bring a doctor back to the United States, train them, and put them back in that community and give them the resources so that they can do the surgery themselves. So, rather than feeding them a fish, we would teach them how to fish. It's a privilege to take care of people. They put their confidence in you, and I'm honored that they do that, and I want to do my very best to live up to their expectations and do the very best job that I can.